Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern, and new face here is Howard Cooperman from our web marketing department. He's gonna help us with some of the questions revolving around the VA privatization. He is a former VA director of business and finance of the Greater Los Angeles area. He wanted me to point that out, and he has worked for the VA in multiple titles for over 42 years. Yes, over 42 years.
That is correct.
42
years, 10 months.
And another special guest is with us on the phone from our Indiana office. He's Morris Smokey Graves. He's a retired military and also has experience in utilizing the VA services. And the reason why they're here is because our topic is about VA privatization. Now, there has been talk for the last couple of years about privatizing the VA, and it's picked up some steam the last couple of weeks as Congress has been exploring this idea of VA privatization. The VA Secretary David Shulkin has stated that fixing the VA was a matter of national security. Now, getting away from the politics of it all about whether we should privatize it or not privatize it, we actually want to understand this idea, and that's the main reason why Howard and Smokey on the line has joined us. So for the first question, we want to know, what is the current VA system? Maybe Dr. Stern can help us with that.
Yeah, I'm going to hand it off to Howard and Smokey, but let me put this in context. When the team brought the subject to us, in full disclosure, Howard obviously has had experience with them before working with us, and Smokey's had experience as a utilizer. Also note, though, that I did as a staff member with the VA, and I ran research hypertension clinics there. So it's fair to say that we have some experience with it. But having said that, it's important to take a look at the world where the VA is the largest healthcare system in the country. There are other large healthcare systems, and now the question is, are there issues that are going on at the VA that are also endemic in what's going on in other large healthcare systems, whether they're Kaiser or Group Health or Harvard Health Plan or some of the others in what goes on. Having said that, though, I'm going to hand off to Howard to talk for a moment, because a lot of the issues that people are bringing up have to deal with ambulatory clinic issues, not hospital issues. So I think we can put to the side, and everybody can correct me, but we need to put to the side the issue of people having access within hospitals and the kind of surgeries or the needs that they have with an acute care setting. That's to the side. That is not the issue that's going on right now. The issue that's going on right now has to deal with clinics. Howard, do you want to introduce what's going on with this?
Yeah, from what I've read, understood, and when I worked for the VA, there were two issues. One, you're right, was the outpatient access to outpatient care, but also veteran benefits. People don't realize the VA is multi-divisional. There's the Department of Veteran Benefits, of course. There's the hospitals, and then there's also national cemeteries. The two problems that have come up have been people getting their compensation and getting the outpatient treatment. And most of the outpatient treatment is the problem because of the specialties, which is...
And you're talking about specialties, meaning medical subspecialties.
Medical subspecialties, orthopedist, dermatology, and of course dentistry. That has been a problem for years and years and years, as it is in the private sector.
And what about mental health? That's also been an issue. All the talk about PTSD and everything, but mental health issue is also a concern.
One of the problems that we're having from the war today is more and more people are coming back with PTSD, Agent Orange. I don't think anyone expected the amount of people coming back with those issues, and essentially the VA was not prepared. I think that they've made great inroads in trying to address the issues. in Vietnam, we lost 54,000 people. Modern medicine has now been bringing more wounded back, and with wounds you get medical problems and mental health problems.
Smokey, do you want to contribute anything to that? Smokey was involved with recruitment and retention of military. Any comments to add to that, Smokey?
Well, I would say over the years that I've utilized the VA system myself, and primarily out of the outpatient clinic care, I can say, and this began in 1995, you could see the increase of people that would visit or would be at the clinics that I would make my own appointments. From the beginning, it was an older set of us soldiers and sailor and airmen as well. And as the years went by, of course, from the number of years we've continued the missions we have around the world, it became younger and has become younger and younger as well. So the flow has certainly increased, and it's been the VA's mission to hold to that flow and provide accordingly. And I had an appointment not that many months ago, and in my case, it was simply an in and out visit from the time I got there to the time I left. Within 45 minutes, my care was given. I was out of the building, but certainly as you look around, the increase is absolutely there.
I think one thing is when we had high unemployment, we had more people going to the VA because they lost their health insurance, and of course the VA was there for them. Also, with the high cost of medicine, more and more people are going to the VA for their prescriptions. But in order to get prescriptions from the VA, you must be seen by a VA physician, which put a big impact on the outpatient clinics.
Yeah, if I may add, I would tell you the number of folks that I have spoken to, the VA is their primary caregiver. As in my case, it has been since they are retired. They are my primary caregiver.
Interesting.
So we've got a kind of a broad scope of some of the issues that you may have heard, maybe read online, or maybe experienced yourself. But what we want to know is the VA system as a whole. What type of patients are the VA seeing, other than just the obvious veterans? But what classes of people or population utilizes the VA?
Howard, do you want to have any thoughts about it?
Because I just want to add, we know that veterans have the ability to choose between whether they want to just go with private insurance or they want to go with the VA. What makes a person choose the VA over private insurance?
Yeah, well, let me add one thing to that. Howard brought it up yesterday in our conversation, and that is the inventory of veterans that are being seen by the VA today is a different demographic than what it was. In the past, obviously, it was males, and when I was on clinical staff and ran my research hypertension clinics, my only draw was from males, and males that were in general from World War II, the Korean engagement, and some of the other engagements, Vietnam, etc. But today there's women, which was not something that was set up for, and others. So the demographic has changed, and clearly you may want to add to that.
Yeah, that's since the 60s, the VA has seen more and more women veterans coming over to the facility. Also, now, again, when I first started back in the 60s, a lot of the VAs were not affiliated with medical schools. Back in the mid-60s, closer to the late 60s, every VA hospital has become affiliated. They become affiliated with medical schools, and most of the medical schools have their hospitals. So a lot of the specialists, a lot of people come now to the VA because they want the specialists that they can see through the university and through the VA because of the direct affiliation. You might have a physician with the VA who also has a professorship at the university. And also some of the research the VA does is phenomenal in order to help out the veteran.
So what that attacks is something that we see today across healthcare, and that is, one is quality. Clearly affiliating with a university has some benefit. I'm not making an apology or otherwise, I'm just identifying many of the major health plans today do not have affiliations. Clearly there is something there. And two is access to some of the subspecialties that perhaps may not be common. I was involved in cardiology, and that's pretty common, but you deal with some things like infectious disease and others where it's not very common. And because they're involved with both the hospital and the clinics and with the university, you can draw from that inventory of subspecialists in order to deal with care.
As one of the biggest specialties the VA is famous for is the quality of spinal cord. They are known nationwide for their spinal cord injury type of care. And in fact, when I worked at the VA in the Boston area, private citizens who needed spinal cord in some cases would come to the VA for emergency type care. Instead of going to like a Boston hospital, they would send them to the VA first, and the VA would affiliate with the private hospital. So nationwide, spinal cord is a big specialty that the VA is known for.
Okay. Well, moving on, we want to also explore some of the solutions that have been floating around. We've noted some of the issues that some people have stated regarding the VA, whether it's the care, the wait times, lack of hospital beds, whatever the case is. We want to know, what are some of the solutions that we have heard revolved around fixing the VA system?
Yeah, let me add something to it. In all major healthcare systems, there's an issue with regard to access. How can people access healthcare? How long does it take? In Medicare, there's issues that are geographic about how many doctors are within 5 miles of given individuals, 10 miles, etc., with regard to access. The other part of it has to deal with the quality issue, and clearly there has been problems that have occurred from the quality issue. And I think one of the things we should add to your question is this something that is geographical, meaning it's a problem in Arizona, but it's not a problem in Kentucky or California, or is it a problem that's universal, and how are they handling that? So without being an apologist or trying to handle it one way or the other, I think we do need to identify and determine, is this a US-wide problem? Is it a problem in some areas? And then clearly in what you're talking about, how do we solve it?
Yeah.
The VA has always had a system where if in fact you were like 40 miles further from a VA, they always had the fee basis where a veteran was able to go to a private physician and the VA would pay for it. Back in the 80s and the 90s, we started opening clinics in rural areas and areas where it was easier for a veteran, instead of going to his local VA, which might be even 14 miles from, say, the San Fernando Valley where we are to the city into Los Angeles, we opened multiple outpatient clinics. In the LA area, we opened in Bakersfield, we opened them in Santa Barbara, we opened them in San Luis Obispo and Santa Maria, and I'm sure I know some of the other VAs all over open clinics all over. Since the problem has been recently, they've come up with what they call choice, where if in fact it's a long, maybe 30, 60, 70 days, 80 days for you to see a VA physician, now you can go get permission from the VA, sort of, go to a private of your choosing, and the VA would then pay.
What about this issue? I mean, let's go back for a minute because I think that's important. The question has come up significantly, certainly with the problem that happened in Arizona,
Right.
and now the question about whether it occurs in Indiana and Kentucky and Tennessee and all of that. Was that a limited problem, or was that a problem that occurred across everything?
Maybe Smokey can help us.
And Smokey can probably help us with that more nationally. But was the problem in Arizona a limited problem? There was only an Arizona problem, or was it a problem that occurred everywhere?
I think it was identified as an Arizona problem.
Mhm.
I don't think there was the type of problem that was created in Arizona where people were basically throwing things away. The only thing I could think of is they were overwhelmed, and the clerks themselves didn't know how to handle it. Their way of handling it was brushing it away. I do not believe that that was a nationwide problem. Now,
No, I think that if I may, I think that if it were, we certainly would have heard more of that issue, and it just didn't happen. It was, it was isolated in the Phoenix area. But again, I truly believe if it were nationwide and if it were as bad as what we heard out of Phoenix, we would have heard it out of the other area of the nation as well.
Well, it's pretty egregious. So clearly, that was kind of a lightning rod for what was going on. But this happens in all healthcare systems. You have a problem in some area, and you want to know whether it's systemic or whether it's something that you need to clean house and wherever you are and address the problem and then move on. So that's always an issue. So thanks for that.
oh, it was a tickler. There was no doubt. I mean, I'm sure every VA in the United States started looking at what happened in Phoenix. And number one, is this happening here? And let's not let it happen here. Whatever resources we need, let's go make sure that our outpatient treatment of care is being taken care of.
And also, if I remember correctly, that also sparked a huge revolution for integrating more technology into healthcare, where they saw that most of the VA medical records were all paper, and they wanted to kind of revamp the VA in a way to where putting all those digital records into digital format.
Yeah.
So,
Yeah, that makes sense. And
Yeah.
Smokey, your experience extends to multiple states there as well. Am I right?
But it does. Visiting the VA hospital at Louisville, and that's where my VA healthcare began, to Nashville, Tennessee, and at Vanderbilt Hospital where the VA is located. And of course now I'm served through the Marion, Illinois VA hospital and a clinic in Evansville, Indiana. And I've utilized the Marion VA hospital for issues with my hearing. And again, the time that I spent with the VA hospital there, it just a normal day at work. I was there, they attended to me and sent me on my way. I watched a numerous amount of people coming in and out, and honestly, I'm an observer, and I watched it. They were absolutely being handled in a timely manner. There was no long wait to get back to see the physician, or at least to the nurses center to prepare you for your appointment. But that being said, it's not that I'm there every week, but for the 3 trips that I've made there, that's been my observation. Is I'm watching the veterans being moved in and out in a timely manner, using that facility, using Louisville and Nashville.
So effectively, clearly we're not presenting a study or any kind of research as perhaps we've talked about in the past.
Right.
And we're certainly not speaking as administrative staff for the VA, but we're trying to understand what it looks like in California, what it looks like in Kentucky, Tennessee, Indiana, and potentially other spots, just based on experience of what's going on. So we have, at least, you're right, a tickler that started at everybody looking, but clearly somebody had to clean house in Phoenix, because that's egregious, and whatever else had to happen somewhere else to deal with it.
Right, and from what we're hearing, it could be a dense population issue versus a less dense population. Maybe the overwhelming factor kind of fits in there. And But another issue that we can look into is analyzing what would happen between privatization or asking Congress to increase the budget for the VA. There's a lot of talk, a lot of backlash about whether or not we're assigning appropriate funds to the VA. Responses to that:
Well,
privatization versus increasing the budget.
yeah, let me deal with it in a broad perspective and then give it to Howard and Smokey. In a broad perspective, there is this argument going on today between government management of healthcare and centralizing it versus having it more decentralized and dealing with that. Clearly, technology is helping all of healthcare because the changes didn't happen in healthcare. They happened in Silicon Valley that then spread throughout healthcare in giving more technology, more web-based, more computers, more issues in mobile computing and things like that. So that's happening. It's happening everywhere. The question that we need to address is how do you deal with this privatization versus dealing with this internally? And if there's already some move, as Howard's talking about, where it's internal, how do we deal with this then where people are talking about it? The Koch brothers, I think, have put a lot of money into trying to privatize. The question is, what do you get in addition to what you're already doing? How do we improve it? Because at the end of the day, this is about improving care for a bunch of veterans.
Yeah, I just don't think that the VA was properly funded for the increase in the amount of veterans that are coming to the facility as an outpatient. I don't think they were expecting all the people who were losing their health insurance, the cost of drugs, where people are now coming to the VA for their medications. They're coming towards the VA for some of their specialties, and they're coming to the VA that are being discharged from the military more frequently because the military was downsizing. But remember, when they retire them from the military, or they leave the military, they go from being seen by a military hospital to being seen by a veterans hospital. Right. So I just don't think the VA is today being funded properly.
I'm sorry, Smoke.
Well, I think my take on that is this. I am the local post commander of the American Legion, Post 142 here, and have been for a number of years. And I can tell you that my Legion members, as we gather monthly and as we have our conversations elsewhere, is that I don't think I have a member there that would even consider privatization of our VA healthcare. It to them is certainly all about the budgeting, and it to them, our members, is the fact that they had been promised health care for the rest of their lives, those that have retired, and they would expect that through the VA and not through privatization. Now, I can say this, that those members that had the Veterans Choice Card, they appreciate the opportunity to use it, but they still know they come under the rulings of and guidance of the Veterans Administration. So as a Legion member and as a leader in the Legion, our people say no to the privatization. Show us the budgeting.
Right. And,
Well,
to go along with what Howard was saying here, when he talked about the increase in population that the VA is now responsible for, you also have the increase in healthcare and medical costs, and a lot of drug costs too as well.
And
drug
equipment,
cost is
you know,
is huge.
you want the VA to have all the modern equipment that they have in the private sector, the MRIs and the CT. Those are very expensive, and again, you want them to keep up with modern medicine and modern equipment.
Yeah.
Well, let me take a point here for a moment because I think Smokey brought it up and I think we need to address it. And that is, on one level, there's a budget issue that says you didn't give me enough money, give me more money. And we know that Congress is in a position right now where they're not looking at giving more money to anything. They're talking about decreasing money. So we have to be budget sensitive over the fact that we don't have a political climate that is talking about giving money to anybody.
Right.
But at the same time, Alex is right, and that is the cost of healthcare itself, whether it's in the VA, whether it's in private sector or otherwise, is increasing dramatically. We have talked a lot because we are analysts in that area and we are or go-to people in that area with regard to the new specialty drugs and the cost of these things that are now averaging at about $1,500 a dose. Howard is talking about the fact of new equipment. So there may be something, and I put it to both Howard and Smokey here, that there's the administrative function of the VA where the VA is administering, making sure that people are getting appropriate care, appropriate quality, etc. Clearly, there's an issue with regard to having data so that it's all together. So if you go to one provider, one doctor, cardiologist, or anybody outside the system versus going to someone inside the system, that the data still exists so you know what's going on. And the other side of it is trying to keep the VA current. So I guess the question for both of you is, if we're dealing with the administrative function, I don't see that going away. That seems to be relatively static. The question I think that they're talking about in privatization is not whether the administrative function of the VA goes away, but rather their ability to go to a private primary care doctor, a private cardiologist, a private enterologist, a private gastroenterologist, a private rheumatologist, whomever. What do you think of that? Is that a problem? Because clearly, if technology improves or is improving, then that data will be available. But then the question is that if Congress doesn't give more money to deal with the equipment that's necessary, clearly outside the VA, some of that does exist. What do you think?
But the VA does offer the VA choice now, where if in fact the cardiologist can't see you, or the gastroenterologist, your appointment is 4 months from now,
or even if the equipment is inadequate.
Right. Yeah. Then they could send you elsewhere. There are certain, I know for a fact that they'll send a patient from the hospital across a street, so to speak, over at the university, who in fact has that expertise, and the VA then will pay the university for the treatment if they just can't do it, or they send them to special clinics outside of the VA, and the VA then under the fee basis would pay for the treatment.
So the contact with the universities is critical because it adds to
very critical
the ability to be able to use some of the new technology, new experience of subspecialists, etc.
What I have found, though, in a lot of cases, the university comes over to the VA in a lot of cases, because in some cases the VA has some of the updated equipment than sometimes the universities does, especially in rural areas.
But I think another issue that I've read about with regards to what veterans are saying about the VA privatization is, would this now become more costly if, say, the VA does become a private institution? Would this be costly to the veterans? Would this mean a rise in copays or involving them in issues that are now involved in American society, where they're talking about the rise in healthcare costs and rise of copays and premiums and so on and so forth?
In a broad perspective, that problem exists in private care. It certainly will involve in the VA and others. And the issue here for us is that there are networks and restricted networks, and in private insurance as well, you have doctors that have accepted the rates that the plans will charge to treat different problems. If people go out of network, then there are either the services would not be covered, or they would be discounted to another fee. So that exists today across all healthcare. The question is, what does the VA do about it with regard to people going outside in the choice program or otherwise? Do they discount them to a particular fee, a contracted fee, or is it fee for service?
If the VA has, if the patient has medical insurance, they will bill whatever medical insurance you have, and the medical insurance will pay accordingly. The only thing the VA, and again, it's been a while since I've been with the VA, I don't think they get Medicare. So if the patient is eligible for Medicare and they go to the VA eats the cost. If they go and they have Blue Cross or Aetna, then the VA will bill Aetna, Blue Cross for the service of the veteran.
It's all very interesting stuff. And I believe that's going to be all for the topic today. Unless, Smokey, did you have something to add to that?
Well, just simply put, you take a veteran who's being serviced by the VA, if I may put this in, that's being serviced by the VA for their health care. Two things they look forward to. That is, one, they know that they're going to be sent to a clinic and be seen by a doctor. Secondly, for a minimal fee, they can sit at home and expect in their mail their medications are prescribed to them from the VA. They're not asking for much more than that. So the opportunity to have that happen and continue to happen for their lifetime, that's what they're expecting and looking for. And when you use the word privatization, then the concern begins. And when you're 87 years old and you're not capable of climbing in that car, or your county service veteran officer doesn't have the vehicle to get you to that clinic, or get you to renew that medication, it's always good to know that it's going to be brought to the house, and you can always fall back on one of your service clubs to assist you in that manner.
Right. Some very good points. Well, that's going to be all for today. We're kind of ran a little bit long today, but we hope this information was helpful to you. And if you feel the need, you can pass it on to anybody who's interested in this topic. What you could also do is visit our RxInfoX page. It's on ProPharmaConsultants.com. And if you have any other questions or messages, please feel free to leave it below or message us directly. If it's private information, feel free to contact us. And we will have a new video for you next week, and we'll see you then.